Hi there, welcome back to the Qualicare Family Home Care YouTube channel. My name is Trevor. This is Teresa Craig. She is the franchise owner of Qualicare for Edmonton East, Fort Saskatchewan, Sherwood Park, and that's it. St. Albert. Yeah, I think I got it all. Next. So today our topic is Home Care for Saskatchewan, a reminder about COVID-19. A quote from Marie Curie: "Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less." I like that one, that's really good. A quick fact from the Public Health Agency of Canada: at this time there are 71,450 active cases across the country. The latest national level data indicate daily averages of 6,168 new cases and 74,596 people tested daily, with 7.4% testing positive. So don't be scared, it's just cases. So we're going to be talking about that today. So tell us a little story about what your experience has been with COVID-19 over the past year.
Well, as we all know, the COVID-19 pandemic has been with us for quite a while, and we just wanted to send out a reminder of what we know about COVID-19 thus far and how we should be handling it. The information we're presenting comes from the World Health Organization, or WHO, and it's about the coronavirus that we presently have, and hopefully we can talk about also the variants of the COVID-19, which is just the mutations that have been happening as well.
All right, so we're here just to give you the facts as they're presented to us. So number one, what is COVID-19? You probably know what it is, but we're going to tell you anyway.
Well, the COVID-19 is a disease caused by the coronavirus called SARS-CoV-2. It was first acknowledged way back in 2019, December 31st to be exact. And we found out that there was a report of viral pneumonia in Wuhan, which is the People's Republic of China.
Okay, now what are the symptoms of COVID-19?
Well, it closely resembles the flu. So we have fever, dry cough, fatigue, muscle soreness, conjunctivitis or eyes red, watery, sore throat, headaches, muscle or joint pain, nausea and vomiting, diarrhea, chills or even dizziness. But some people are also reporting a loss of smell and taste.
Interesting.
Yeah.
Okay, so what happens to people who get COVID-19?
Well, it depends on the person, it depends on their age and their physical health. So anybody over the age of 60 years old is more at risk for developing severe conditions, and those can be a shortness of breath, loss of appetite, confusion, persistent pain in the chest, difficulty breathing and taking in a nice big breath. Also very high temperatures, greater than 38 degrees Celsius. Again, anybody over the age of 60, and those people with medical conditions such as diabetes, any kind of chronic illness, those people are more at risk for developing the more severe form of COVID.
Okay, now who is at most risk of, or most risk of severe illness from COVID-19?
Well, again, those are the people that are greater than the age of 60. Those with chronic disease conditions, those people are at risk for developing a severe form of COVID, and you might even need hospitalization. And of that, some of the people actually develop severe enough symptoms to warrant a stay in the ICUs.
Okay, now, do we know if there's any long-term effects from COVID-19, seeing as it's so new?
Well, children, although they don't really display a huge amount of symptoms, and sometimes they don't even show symptoms, they are at risk for developing an inflammation a week or so after they get rid of the COVID-19 strain that they got. So that can come in the form of intestinal issues, lung issues, that type of thing. And they're at risk for developing those symptoms. A lot of the adults who do develop COVID and the symptoms involved will oftentimes get over the initial symptoms, but then stay tired or have muscle soreness, and that can go on for a long time, and it really depends on the person. So it varies.
So how can we protect ourselves and others from COVID-19, especially if we don't know who's infected?
All right, well, we have a practice called social distancing, and in most areas you also have to wear a mask. And what the WHO organization is recommending is a 3-layer mask. And although if you do have a 2-layer mask, that's fine as well. You want to maintain that social distancing of 2 meters at least between each other, and wear our masks, and those are the main things.
So Teresa, when should we get tested for COVID-19?
So if you have come into contact with anybody who has COVID-19 that you know of, that is an excellent time to get tested. It's also a good time to get tested if you notice you have symptoms such as those that we discussed earlier: sore throat, fever, cough, loss of taste, loss of smell, all those kind of flu-like symptoms. That's a good time to get tested as well.
Okay. Now, what's the difference between isolation and quarantine?
So quarantine is used for anyone who is a contact or someone infected with the coronavirus, whether the infected person has symptoms or not. Quarantine means that you remain separated from others because you have been exposed to the virus, and you may be infected and can take place, and that can take place in a designated home or facility. This means staying in a facility or at home for 14 days. That's quarantine.
Okay. Now, can Qualicare help someone if they are in isolation or quarantine?
Yes, absolutely. When Qualicare gets involved, we need to know, though, right away that this is a COVID-19 involved case. And that helps us to make sure that our caregivers are then equipped with the proper PPE to help these people.
Awesome. Now, the next question is, how can we contact Qualicare if we need some help?
Well, you can go to my website, which is qualicare.com/Edmonton East, or you can call me at 780-328-6655. And we're there 24/7. And even if we don't answer the phone right away, we will get back to you within the 24 hours and chat with you regarding your needs.
Awesome. Thank you so much for joining us. Hopefully this has been informative, just a refresher on COVID-19 and what you should do to keep yourself safe. We'll see you guys on the next video.
Bye.